Hello friends, today we are going to discuss here about very high yield MCQs. An elderly male came to OPD with bilateral basal crepitations, dyspnea, pedal edema, distended jugular veins and positive hepatojugular reflex. What is the condition likely? So this is not a cause of left ventricular hypertrophy, acute pericarditis, dilated cardiomyopathy. Here we see basal crepitation bilateral. Okay, features of left ventricular failure, dyspnea here, pedal edema, distended jugular vein. This is a case of right heart failure plus positive hepatojugular reflex. So right and left heart failure, both conditions are seen here. So what is this condition? Considered as congestive heart failure. Congestive heart failure. Water hammer pulse is seen in. So guys, all option in front of you, try to answer. This is very important. Multiple times in exam they like to ask this water hammer pulse. So seen in aortic regurgitation. AR, MS is mitral stenosis, aortic stenosis, mitral regurgitation. Now water hammer pulse is seen in aortic regurgitation, anemia, pregnancy or all. This is very simple. In anemia we can see this aortic regurgitation and pregnancy. So D, all options are right here. Pulsus bisferens. Which of the following is not true? It is seen in aortic regurgitation. It is better felt in peripheral arteries. It has one peak in systole, one in diastole, or it has two peaks. So this is rapid revision videos for NEET PG 2023. So this is the answer here. It has a one peak in systole and one in diastole. So this is a false statement. Now, which murmur increases on standing? HOCM is hypertrophic obstructive cardiomyopathies, MR, MS, mitral regurgitation, mitral stenosis, VSD, ventricular septal defect. So the single best answer here is HOCM. Here we find murmur which is increase on standing. Now Carey-Coombs murmur is seen in acute rheumatic fever, infective endocarditis, systemic lupus erythematosus or patent ductus arteriosus. So here single best answer is acute rheumatic fever. Acute rheumatic fever. Osborne J wave is seen in multiple times in exam. They ask this question in so many different examinations. Hypothermia, hypokalemia, hypocalcemia, hypokalemia. What is single best answer? So guys, if you want to join 500 high yield video subscription program or rapid revision 6-hour videos program for NEET PG 2023, fee for that program is 6,000. And how to join that subscription program, details available in description of this video. So answer here is hypothermia. Okay, hypothermia. Answer is hypothermia. This is the single best answer, Osborne J waves. Which of these statement is true for bundle of Kant? An abnormal pathway between two atria. It is a molecular or nodal pathway between atria and ventricle in WPW. It is slower than AV nodal pathway or none. So guys, this is simple answer. This is a case of it is a muscular or nodal pathway between atria and ventricle in WPW. Which of the following causes AV block? Hypothyroidism, hyperthyroidism, pheochromocytoma or carcinoid. Single best answer here, that is AV block is caused by hypothyroidism. In hypothyroid patient you find AV blocks. Which of the following is the most common abnormality in ECG manifestation of pulmonary embolism? T wave inversion in V1 and V4, sinus tachycardia, U wave, S1, Q2, T3 pattern. So what is single best answer here? Single best answer here is sinus tachycardia in pulmonary embolism. Now identify the ECG. Very easy. What is this? What is this? Look like Sawtooth. What is sawtooth? Seen in Sawtooth seen in which condition? Very, very important. You have to answer all options in front of you. In atrial flutter. Sawtooth appearance seen in atrial flutter. Very easy ECG. Identify the ECG. This is a case of what? PSVT, paroxysmal supraventricular tachycardia. What is drug of choice in PSVT? Adenosine. In ventricular tachycardia, verapamil. If PSVT adenosine is not mentioned, then choose verapamil, calcium channel blocker. Now, which of the following is not a cause of mitral stenosis? Core triatum, atrial myxoma, systemic lupus erythematosus, cryoglobulinemia. So answer here is cryoglobulinemia is not a cause of mitral stenosis, rest other are causes. In mitral stenosis, double shadow on X-ray chest, PAV is due to enlargement of. So mitral valve you see where? Mitral valve you see in left atrium, okay, left atrium. So left atrial enlargement we see. Contraindication for percutaneous balloon mitral valvotomy include the following except presence of pulmonary hypertension, left atrial thrombus, severe mitral regurgitation or commissural calcification. So all of the following are contraindication of balloon mitral valvotomy except. So answer here is presence of pulmonary hypertension is not a contraindication. Now, infarct involving which portion of myocardium cause aneurysm as a post-MI complication? Subendocardial, anterior transmural, posterior transmural or inferior wall. So this is a very easy, very simple. So here answer is anterior transmural. Okay. Now, which of the following is not true about Prinzmetal angina? Severe ischemic pain at rest with ST segment elevation. This statement is correct. Focal spasm are common in right coronary artery. Also correct. Nitrates and calcium channel blockers are mainstay of management. Also correct. Aspirin treatment decreases the episodes of angina. This is false statement. So they are asking not true. So this one is a single best answer here. Rest all three are false. Okay. Now, hope it's clear till here. Reciprocal change in ECG in patient with inferior wall MI are seen in which lead? First, second, third and fourth. So answer is first. A. Alcohol causes which type of cardiomyopathy? Very simple, very easy. Even no need to see options. Direct when you are sleeping, you have to answer such question. Dilated cardiomyopathy. Essential major blood culture criteria for infective endocarditis is single positive culture for HA, single positive culture for Coxiella, single positive culture for Corynebacterium or both A and B. So which one is the single best answer? This is A option is the right here. Now, following ECG manifestations are seen in acute pericarditis except ST segment elevation with upward concavity in V2 V6, ST depression in AVR or T inversion or prolonged QRS complex. So this is very easy. Answer is prolonged QRS complex, not seen in case of acute pericarditis. Hemorrhagic pericarditis can be caused by tuberculosis after cardiac surgery, metastatic disease or all the above. Very simple, very easy. In all of these conditions, hemorrhagic pericarditis is possible. Now, implantable cardioverter defibrillator is used in Brugada syndrome, arrhythmogenic RV dysplasia, post-MI with structural damage or D, all of the above. So this is also a very easy answer here is D. Okay, all of the above is single best answer. Permanent cardiac pacing is helpful in Brugada syndrome, post-myocardial infarction AV block, ventricular fibrillation, transient AV block. So single best answer here is, in case of post myocardial infarction AV block, permanent cardiac pacing is best. Ischemic dactylitis is seen in case of hemophilia, thalassemia, sickle cell anemia, hereditary spherocytosis. Ducty large. So what is left? Mnemonic is thalassemia. Here the answer is thalassemia. Very important. Now, all but one is true for beta thalassemia measure. Growth and development is impaired. Red cell count less than 4. Levels of HbA2 less than 3.5%. Bone marrow iron is depleted. So best answer here is bone marrow iron is depleted. Now, Coombs positive hemolytic anemia is associated with TTP, thrombocytic thrombocytopenic purpura, SLE, systemic lupus erythematosus, PAN is polyarthritis nodosa, HUS hemolytic uremic syndrome. So where you find Coombs positive hemolytic anemia? In SLE. Very, very important. Characteristic feature of hemophilia is hematemesis, hemarthrosis, hemoptysis, bleeding, varices. If you work in an orthopedic department or in a physiotherapy rehabilitation center, you find hemophilic patient with hemarthrosis. Okay, so this is a common characteristic feature. Which of the following is not a cause of secondary idiopathic thrombocytopenic purpura? SLE, hepatitis C infection, rheumatoid arthritis, HIV infection. So single best answer for not a cause of secondary idiopathic thrombocytopenic purpura is rheumatoid arthritis. Now, M proteins on immunoelectrophoresis is multiple myeloma. Patient is most commonly formed by. So IgM, IgG, IgA. So answer is IgG. Okay, IgG in multiple myeloma. Drug used in management relapsed multiple myeloma is bortezomib, lenalidomide, doxorubicin, or D. So guys, all three drugs we can use. So answer here is D. PIP, DIP joint involved. PIP paroxysmal interphalangeal, DIP distal interphalangeal joints. With wrist sparing points of diagnosis of osteoarthritis, rheumatoid arthritis, psoriatic arthritis, CPPT. So answer is osteoarthritis. We find wrist is spared. Okay. Haberden nodes are the clinical manifestation seen in. So Bouchard nodes seen in rheumatoid arthritis, Haberden nodes for DIP, that is osteoarthritis. Haberden nodes mainly seen in case of osteoarthritis. Saturnin gout is seen with lead, arsenic, mercury, or cadmium. So this is very easy. Lead is answer here. Lead. Which of the following is not true for the investigation used for diagnosis of gout? Aspirate joint fluid microscopy to identify the needle-shaped crystal confirmatory. This is true statement. Synovial fluid leukocyte count are elevated during acute attack. True. 24-hour urine for uric acid levels used to assessing the risk of uric acid stones. True. They are asking false statement, so answer here is B. Serum uric acid are diagnostic for acute gout. This is false statement, so B is answer here. Okay. Now, female of 26 years present with oral ulcers, photosensitivity, malar rash, sparing nasolabial folds. What is diagnosis? Simple, easy. When you are sleeping, you have to answer such questions. Answer is SLE, systemic lupus erythematosus. SLE. Okay, this one is answer. This B. Shrinking lung syndrome is seen most commonly in SLE, scleroderma, rheumatoid arthritis, ankylosing spondylitis. Very simple. Shrinking lung SL to SLE. Remember mnemonic. Never forget. Shrinking lung SL. Shrinking lung SLE. L for lung, S for shrinking. This is mnemonic. Okay. So shrinking lung syndrome seen in SLE. Which of the following is used as a screening for systemic lupus erythematosus? So guys, when they ask best investigation for SLE, anti-dsDNA. When they ask drug-induced SLE, antibodies, antihistone antibodies. When they ask specific antibody, that is anti-Smith. When they ask screening for SLE, go with anti-nuclear antibodies. Go with anti-nuclear antibodies. Presence of velcro crackles at the lung base on auscultation is a sign of scleroderma, systemic lupus, Wegener's granulomatous, polyarteritis nodosa. So answer single best is scleroderma. Okay. Now 30-year-old lady with systemic sclerosis for the past so many years, with chest x-ray showing bilateral basal reticular opacities, with 4-month progressive exertional breathlessness and pedal edema. What should be the appropriate investigation for that patient? So guys, scleroderma, there is interstitial lung diseases. So best investigation is which one? All 4 options in front of you. Answer is HRCT. High resolution CT scan is the best investigation. Drug of choice for management of hypercalcemia with metastatic bone disease. Very, very important. You give this infusion every 6 monthly, or in some rare cases give monthly also. Alendronate, residronate, pamidronate, zolendronate. You have to give bisphosphonates. Which one? That is zolendronate. Zolendronate is a drug of choice. Which of the following are clinical abnormalities of uremia, hyperphosphatemia, uremic frost, peptic ulcer, or all of the above? All of the above. Okay, answer. If they ask all of the above, most of the time answer is all of the above. Which of the following is not true about IgA nephropathy? Characterized by episodic hematuria and deposition of IgA and mesangium. True. Majority of IgA deposit polymeric form of IgA1 subclass. True. Persistent proteinuria for 6 months no longer point towards bad clinical outcome. True. Nephrotic syndrome commonly developed. This is a false statement and they are asking not true. So B is single best answer. So B is a single best golden answer. Okay. Patient with nephrotic syndrome has decreased amount of which antibodies? Simple answer, that is IgG antibodies. IgG antibodies. Refill criteria is used for diagnosis of acute kidney injury, acute splenic injury, acute liver injury, acute bowel injury. So this is mainly for RIFLE criteria is for acute kidney injury. A. Laboratory findings differentiating pre-renal azotemia from oliguria, acute renal failure include the following except more than 2% fractional excretion of sodium, urine osmolality more than 500 milliosmol per liter water, urine plasma creatinine ratio more than 40, or none of the above. So best answer here is more than 2% fractional excretion of sodium. Oliguria is defined as, guys, when you say anuria, when there is no urine or less than 100 ml urine per last 24 hours, that is anuria. When there is more than 3 liters urine in last 24 hours, consider as polyuria. When the urine amount is less than 400 ml in 24 hours, consider as oliguria. Okay, so oliguria is less than 400, anuria is less than 100, polyuria is more than 3 liters per day. So guys, thank you. If you like this video, put like on it. And if you want to join subscription program for NEET PG examinations, more than 500 high yield topic wise videos available, and revision videos also available in a folder. So fee of that program is 6,000 rupees. And how to join that subscription program, details available in description of this video, and helpline WhatsApp number is also there. And if you like this video, don't forget to put like on it. Thank you.